these emailed comments will be recorded as part of public comment for this meeting. At this time, I'd like to call for questions of the staff by board members on the adoption of the Board of Health COVID-19 response emergency rules and regulations. Do you have any comments or questions from board members?
Mr. Chair.
Yes, Mr. Honhausen.
Thanks. Hi, everyone. I'm just wondering, because we may have some public that's new to the effort and all of that weren't here for the last meeting, that maybe just a recap of what we're doing, just a short summary of the effort. And then I know that we had great discussion last time and made some amendments to the document. And so maybe just some discussion about that, and maybe Brenda can assist us with that, and maybe Councillor Lane as well. So thank you, Mr.
Great,
Chair.
thank you. At this time, I'll turn it over to Brenda.
Thank you, Chair, Mr. Chair, members of the board. Today's a really important day. So the Board of Health exists in our county to protect the health of our public, and right now, more than ever, in the middle of a world pandemic, your position and your job is real and extremely important. So I appreciate all of you to start. Your dedication to this, the residents of this county, is heartfelt, and your dedication is true. And so thank you for that. So the purpose of the emergency rules that have been discussed now over the past several weeks with the Board of Health is that it adds to a really nice comprehensive approach to responding to this pandemic. And so just like we have over the last 10 or so months in the response to the pandemic, we've relied very heavily on what we call non-pharmaceutical interventions. And we've had to do this because we don't have a vaccine that's widely available for the greater public at this time. So those non-pharmaceutical interventions have really been, keeping distance, wearing your mask, washing your hands, sanitizing surfaces. There have been some restrictions in place when it comes to various industries. And also, of course, along with all of this, we've done some really pretty extensive messaging in the community to help build understanding. We've been learning together for months now. This is a novel virus that we knew nothing about in the very beginning, back in March, when we put an emergency, public health emergency declaration in place in this county. We knew very little. And as we've progressed through the course of this pandemic, we have learned quite a bit, and we've shared that through various methods of messaging in the community. These mitigation strategies that we've been using all along have helped to slow the spread, absolutely, in our county. We've been able to protect the most vulnerable, including our healthcare capacity. These instruments, these tools that we've been using, distancing and masking and washing hands and surfaces and so forth, these are really instruments of freedom. They have allowed us to go about business as we've needed to in this community. We've been able to keep businesses open and schools open because of these public health strategies. Without the masks and the distancing and these other comprehensive efforts that we have had, it's likely that we would have had to be under a more strict lockdown situation. So again, these strategies have really worked to allow us the freedom to go about our essential business in our community. They have facilitated our ability to go about business and have schools open, people accessing medical treatment as needed, and so forth. The thing about public health is that we're all about prevention, that our goal and our aim is always to prevent something from happening, prevent illness from happening, prevent death from happening. And unfortunately, that is really hard to measure sometimes. And I think that that's what's happening in our community right now and across our country, in our state. We're not alone. We're not in a bubble here in Lewis and Clark County. It's been really difficult to measure the impact that these non-pharmaceutical public health interventions have had over the course of the last 10 months. However, there are some models that have shown that if we didn't have these basic public health measures in place, that we would have had many more, thousands more cases and thousands more lives lost to the virus. These models show that because we have had some tools in place, that they have worked and that we have protected the public by using these strategies over the last few months. So in an effort to ease the transition between our current governor and the directives that Governor Bullock has put out statewide to protect the residents of our community, and the transition into a new administration that will be happening in this coming month, we are unsure what those ongoing statewide directives and restrictions might be. And so at this point, it really comes back down to the local level and the responsibility of Lewis and Clark Public Health, the responsibility of Lewis and Clark City County Board of Health to continue and maintain, most importantly, the protections that we have had in our county up till this point, and maintain those protections until we are to a place where we have mass vaccination happening and that vaccine can then take over for the public health protections that we are using right now, these tools that we're using right now. Further, the county attorney recommends that at the local level that we have the Board of Health rules and regulations in place, as it will work with us as far as enforcing the rules. When we have a Board of Health rule that's gone through this really important process and public comment has been received, and you've worked together as a team to develop and adopt rules, then the enforcement of that is grounded and supported by statute. That authority that you have to put rules and regulations in place is supported entirely by Title 50 and the statute. And so for these reasons, we've worked with the county attorney's office to draft rules and regulations, and worked with the Board of Health in the last meeting to understand those rules and regulations, to make some amendments to those rules and regulations. At the last meeting, you opened up a public comment period in which the public had an opportunity to submit written comments. They'll have an opportunity today as well to provide public comment to the board. And so through this process today, we will get to a place where we have a document of rules and regulations that are solid and will continue to protect this county, which is our role. This is our responsibility, is to protect the public from the further spread and devastation that the virus has had. Just a couple talking points about the rules specifically. The rules reflect our current restrictions under the governor's directives, with one exception, and that's that gyms were added to businesses that have capacity and closing time restrictions. That was done because the justification for that particular piece of the rule is that bars, restaurants, casinos, distilleries, and breweries are places where we consider there being higher risk for the spread of the virus. Those are places, and gyms as well, are places where people are allowed to take their masks off to eat, drink, and exercise. And so in those scenarios, the risk of the virus transmitting in that environment goes up. And so we understand that now. We understand that these are higher risk environments. And so that is what you see outlined within these rules are aligned nicely with the current situation that we're under with the governor's directives, with that one exception. All other public places are subject to the 6-foot distancing and masking requirement. And so again, this is very consistent with the way we've been operating under this public health emergency rule and the directives under the governor. There is some triggering criteria that is not available under the governor's directives, but this triggering criteria is based on decision-making criteria that we have been using and have had in place in our county now for many months. This has been a transparent decision-making tool and a dashboard that's been available on our public website now for many months. And so adding this triggering criteria into the rulemaking so that it's very transparent, very clear when the rule is in place and when the restrictions then can be lifted is entirely based on these criteria. And these criteria, of course, as we've discussed in the past, are the same ones that we have been looking at, but the triggering criteria are based on several things. We have healthcare capacity that we're taking into consideration, the cases and the level of incidents happening in our county, community compliance, health department capacity, testing capacity, and disease surveillance. So each of these things are taken as a part of the picture, and when looked at as a whole, give you an understanding of the status that the virus is, the impact that the virus is having in our county, and we can then make solid decisions based on this criteria. So the triggering happens if the sum total of the triggering criteria is less than 18, then no rules and regulations are in effect. If the sum total of the triggering criteria are greater than 33, then all rules and regulations are in effect. And so this is a piece to the rules and regulations that we haven't had in place before, that the rules really provide some really clear and specific criteria by which decisions are made on restrictions being in place and when they're not. And the enforcement process as well is outlined very nicely in the rules. This enforcement process is absolutely the same enforcement process that we've been using thus far. It's multi-stage, multi-step enforcement process, and it's a complaint-driven process. So as the health department receives complaint on compliance in the community, our first step is to do some education with the business that might be struggling to comply. And most, up to this point, most complaints are resolved after that first complaint, and our ability to do some education with the business, for example. If there is ongoing complaints and further need for action, then there is, again, in the rules and regulations, a process outlined to then put an order of corrective action in place if needed, and then also work with the county attorney's office if needed. And so again, the rules are very clear and very transparent in how the enforcement process will continue in this county as it has up to this point. As I read through the public comment that came in up to this point, there's a couple of highlights that I will give you so that you can take those into consideration as you're deliberating over the rules. There were quite a few comments made by the public in relation to the mask exemption exclusion. So within the rules, under the section that talks about the mask requirements, there was discussion at the last board meeting to remove the exemption for the medical condition. And the discussion around this was really how difficult it's been for businesses in this community to adhere to the mask requirement when when this exemption exists. And so the recommendation was to help our businesses, help this community, and essentially just say that masks are required, but make sure that businesses understand the importance of providing accommodations for those that are unable to wear a mask. And so that was the direction that the Board of Health went with their conversation at the last meeting. So therefore, we struck that in the rules. However, there was quite a few state, and you all had access to those comments as well, but multiple community comments related to the impact that that has on the community around the mask exemption and the exclusion of that medical condition within the rules. And so I recommend that the board continue to deliberate and discuss that point within the rule. The other piece of, the next piece of community comment or public comment that came in that I would like to bring to your attention is that under the event restrictions section, the part in which the youth activities are defined, both community-based and school sanctioned, the intention here was to require that youth activities and community-based, both community-based and school activities, be required to submit a plan. But those youth activities would not be subject to the limit of 25 nor the 6-foot distancing. So that is one area of the rule I encourage the Board of Health to have conversation about. There may be the need for some editing at that junction as well to really clarify that it's the youth activity that they would be allowed to occur, but the requirement is the plan be in place so that the Public Health Department can assist those that are hosting and holding youth activities that they are done safely at this time. Another area where public comment was received is under the definitions, and it's the definition of school. It was suggested that Carroll College, Helena College, and private schools be considered, private's there. So schools, the definition reads now, school means any public or private K through 12 school. And so this public comment, the suggestion was to expand that definition to also include post secondary and have colleges also included in that definition. And then the last item that I wanted to make sure that the board saw within the public comment was on page 12 regarding the spacing of tables at establishments. And so at this time it reads that that dining establishments must provide 6 feet of physical distancing between groups or tables. The suggestion from the public comment that came in is that those tables, that it not be based on the table, but based on the individual sitting at that table. Our goal really is to maintain distance between people, not necessarily between tables. So that was a comment that I noted as I read through that I'd like the Board of Health to discuss as well. So those were the 4 areas in summary as I was reading down through that I thought the board, I wanted to bring those to the board's attention, make sure that those were discussed today. So at this point, I will be available for questions as a resource to you. We also have the Deputy County Attorney Charlie Lane with us that can also be a resource to you as you're deliberating and discussing the rules.
Great, thanks, Brenda. I'd like to open it up to the board now for staff questions, thoughts, and dialogue on what Brenda spoke about in terms of some of the ordinance around school activities or children activities, as well as distancing at establishments. So I will open it up to board members and staff for questioning.
Well, Drenda, This is Wilmot. We were supposed to have submitted our letter by 5, and our commission meeting yesterday, we finally got through to it. So I just want you to know we do have a letter here that we can submit or read, whichever you prefer.
Thank you, Mr. Chair, Mayor Collins. I do believe that Commissioner Hunhausen also has a message and I believe those could be shared really nicely at the beginning of the public comment period.
Okay, thanks.
So, Mr. Chair, I do have a couple more questions. I don't want to dominate the world here, but with your permission.
Go ahead, Mr. Hunhausen.
Okay, Brenda, and then again, I might ask Deputy County Attorney Lane a question as well. But in reading through the public comment, there were several that were talking about this being a permanent, these rules being in a permanent place, and all of those kinds of things. And I want to address that because we are under a state of emergency. The state is in a state of emergency. The federal government's in a state of emergency. And we have followed suit with those governments. And these rules are enacted within that state of emergency. When that state of emergency goes away, pandemic goes away, these rules essentially get set aside as well, as my understanding. So just a little more explanation that maybe Mr. Lane can add to that as well. Thank you.
Mr. Chair and Commissioner Hunhausen, I'll address that. The rules were drafted with the kind of an implicit understanding that they naturally go away when the triggering criteria are no longer met. That was the intent with the board meeting every 30 days and reviewing these. And with the triggering criteria designed as they are, the intent there is that they're kind of an objectable and measurable community-based criteria. And when those drop below a certain threshold, there are no rules and regulations. If the board decides and they advise, we can revise the rules and regulations to acknowledge that more explicitly for the duration, or if the Board of Health desires, we can change that language in duration to be more specific, that these rules and regulations are in effect during whatever designation you decide. There's a national state of emergency, a state's declaration of emergency, as well as a local declaration of emergency that they could be tied to. So it's up to the board, and I recommend some discussion of how you'd like that to be addressed.
So, Mr. Chair, if I could follow up, please.
Yeah, follow up, please.
That would be my interest, and I'd ask the rest of the board members to consider that. In our discussion this morning at the Board of County Commissioners meeting, where we did write a letter of endorsement for these rules, we did have pretty good discussion around how does this thing sunset. It's essentially clear if you look at, boy, if we don't have any cases, there's no reason for the rules, they go away. But it's not clearly described, and so that was one of the things that the commission really wanted to understand, or have it be very clear in writing. When and how do these go away, whether it's the state of emergency disappears and so the rules disappear, or cases diminish so the rules diminish. So just clearly spelling that out. And that was one of the requests of the county commission, and I think it's a pretty easy one. It's in there now, but it's not really clear, kind of bold and upfront how that happened. So that was one piece of the discussion this morning. And then one more question for Mr. Lane would be, just because again, a lot of the people that might be on today weren't here for our past discussion. So just a little bit about. I thought your letter to the board was very well done, and I just thought maybe summarizing that letter and talking about the law and how what the Board of Health's responsibility is in terms of a pandemic and those kinds of things. Just a short summary of your letter, I think, would be really helpful to understand why we're undertaking this, And again, my understanding is we've been acting and doing all these things in the community already. This really codifies and solidifies the actions we've already been taking. It kind of puts them in writing and says, what are the rules that you're going to be acting under? What are kind of your administrative rules for addressing the pandemic? What happens if the numbers go up? What are you going to do? Well, the rules show that through the matrix. What happens if they go down? What happens if other things happen in the community? How are you going to respond? And these rules kind of put that out in black and white, where before we responded basically with the best public health practices, but we didn't have it essentially in our rules. So maybe just addressing that a little bit, both where this comes from and then why we're doing this. Thanks, Mr. Chair.
Sure, Mr. Chair, Commissioner Hunhausen. As you stated, the reaction to this COVID pandemic in Montana has largely relied on the governor's directives up to this point. Everyone's been doing our best to react according to public health guidelines and in compliance with the laws that are available. This is intended to be a continuation of what we have been doing, which is in line with the recommendations nationally from public health as well as locally. And the intent here is to transition it under a more firmly established legal framework that's statutorily provided. There's not only authority to do this in Title 50, it's actually required that local boards of health adopt regulations to address communicable disease. And this is that action for this Board of Health to consider. Does that answer your question?
Mr. Chair, Mr. Lane, yeah, generally it does. And I really wanted to get that on the record, that we're required to protect the health of the public, and we're required to have rules around the communicable disease, as you said. And there's also administrative rules about adopting these kinds of rules from DPHHS as well. So all of that is well within our authority, and actually it's a shall versus a may kind of thing is kind of what you just said, right?
That's correct. The statutes require that the Board of Health adopt rules and regulations to address communicable diseases and the spread of communicable diseases. So that is what this Board of Health is considering now, are these rules and regulations, which are again a continuation of what we have been doing with some minor changes that Ms. Neiman addressed.
Thank you. Thank you, Mr. Chair. I'll hold off for a little while. I may have more, but thank you.
No, thank you, Mr. Hunhausen. One of the things I would like to open up to the board and staff is the discussion around the state of emergency and making that more clear around when this policy and procedure would be enacted. And I think Mr. Hunhausen summarized it nice. When do we enact this process in terms of a national, local, or state? So I want to open that up for discussion to the board as well. I think it's important that we clarify it, like Mr. Hunhausen saying in this, is everybody thought this was, in some of the public comment that we all read, was it was going to stay. This is a mandatory. Nothing's going to go up, down. This is going to always be in effect. But just for clarification wise, why and when would we would enact this for the safety of the public?
Mr. Chair. Mr. Chair.
Yep, I'm here.
Question for Mr. Lane. The three levels, whether it's national, state, don't those kind of roll downhill, starting with the national, then to the state or local, or which one triggers first?
There really isn't an easy way to answer that. I'd recommend, well, I don't really have a recommendation. If you'd like to tie it to a declaration of emergency, yeah, I don't really have a recommendation for you. That's something for the board to discuss.
Mr. Chair, if I may.
Mr. Chair.
Mr. Lane, thank you. I guess I would, no recommendation. I would think that it would be locally. That would be my suggestion. Maybe Brenda, you can elaborate.
Mr. Chair, members of the board, I just wanted to describe how the emergency rule declaration went into effect. That might help in the discussion. The public health emergency declaration first happened at the national level. Then the governor adopted a declaration at the state level, and then the county commission adopted at the local level. So having an emergency declaration in place at the local level has then allowed our community to access resources that have helped along the way as far as response to the emergency. And so as long as at the local level, there's an emergency declaration in place, and there's also an emergency declaration at the state and national level, then those resources are available. So if that helps at all.
Mr. Chair, Brenda, it helps. Thank you.
Mr. Chair,
Yes, go ahead, Kate.
can we address some of the concerns that Brenda brought up, maybe starting with the colleges?
Yes. Go ahead.
Well, I read the letter from the president of Carroll, and it sounds like a reasonable request. I was wondering what others were thinking.
Mr. Chair, this is Cami. I happen to agree with Bree as well. I think it's reasonable to expand the definition of schools to include a post-secondary education, which would include then both of the colleges in our community.
This is Justin. I'm in favor of that as well within our community, expanding that and putting that into this ordinance. Any other dialogue or questions on that? Be amended?
Makes sense.
Mr. Chair, I'm also in favor of it.
As am I.
All right.
As am I.
And
Thank
Jenny is as well.
Thank you. We'll have that amended into this emergency rules and regulations as well.
Mr. Chair, does there need to be a vote on that? Or a motion and then a vote, I think maybe?
Yes. Do we have a motion to amend that to include the colleges and the universities in the local order?
Mr. Chair, this is Cami. I move to expand the definition of schools to include post-secondary education or / colleges to that definition so that they are subject to the exemptions.
Happy to
Do
second.
we have a second? All in favor?
Aye.
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 All right. Thank you. So, Mr. or Mrs. McLaren, do you have others on there that we need to discuss that you would like to have brought up?
I didn't quite, I wasn't able to fully understand the comment about the table spacing, but that seems to be another comment. Could Lewis and Clark Public Health staff provide us a little bit more explanation on that, please?
Mr. Chair, members of the board, right now, as it reads in the emergency rule, so I'll read it again. It says under section 9, location-specific restrictions, down where it begins, dining establishments must provide for 6 feet of physical distancing between groups and/or tables. And so the public comment and why I agree the board should have a conversation about it is it's really not the tables we're protecting. It's the people at those tables. And so I recommend that we look at that language and see if we can make more clear that we're looking for 6 feet of spacing between individuals.
Mr. Chair, thanks, Brenda, for that explanation. I also had a similar reaction to both the comment and to the wording. I guess my suggestion would be to make it clear that just change that wording and edit it so that it says must provide for 6 feet of physical distance between diners or individual persons, rather than, and then of course the ways to do that are in the sub notes by increasing table space or providing physical barriers. So to me, it's a fairly simple edit in the first sentence to make sure that we are referring to diners or individual persons.
Any other thoughts, comments on that from board members?
Mr. Chair, Bregan, I'm sorry that I'm struggling to find this in the document. I'm working off memory right now.
Bree, it's on page 11. Bottom of page 11.
Okay, thank you. I just want to make sure there's specification in there about like if you go in with your partner, that we're not asking families to sit 6 feet apart, but it might be stated. I haven't heard it read though.
Mr. Chair, I think this is Andy. I think that simple language, it just describes groups of diners need to be 6 feet apart. So I think that's understood though, but it may just make Bree's point is just making sure that language is clear in there, that it's not confusing or someone could misunderstand that. That was your point, right, Bree? I think.
Yeah. So do we have any recommended changes on the dining establishments? Establishments must provide 6 feet of physical distancing between groups
Groups of diners.
other patrons
Diners or groups of patrons.
Please say that again, Ms. Johnson.
Oh, I'm sorry. Or perhaps just strike and or tables, and then it's clear that it's between groups of people, or specify 6 feet of physical distance between groups of diners, and then the rest of the bullets provide the mechanisms.
Chair.
Yes.
One more question about this. Can I be reminded, please, why there's a restriction on the number of people per table? I'm thinking of, a large family.
Mr. Chair, members of the board, this really does speak to the risk associated with being in a public space, having groups together, individuals together, oftentimes from different households. And so that's the practice that we have used thus far is really, when you limit the number of people, then you're limiting the opportunity for spread.
Follow-up question, please.
Yep, go ahead.
How's that been received from feedback from the community and the businesses about whether or not that's been a restriction for families to be able to go dine out together, et cetera, people living in the same house?
Mr. Chair, members of the board, that's not feedback that I have heard necessarily from businesses or from families. It's not a comment that I have necessarily received.
Thank you.
Mr. Chair,
Mr. Berg.
I'm content with the language as is. I think if we start talking diners, then we miss the overall broad concept that it's more than just diners. It's bars, breweries, distilleries, casinos. If anything, I guess it would be patrons, but to me, it reads and makes sense as is. Thank you.
Other thoughts, comments on this particular issue? Dining establishments must provide 6 feet of physical distancing between groups, and we currently have it as and/or tables by, and then the bullet points. The one recommendation from Ms. Johnson is to strike out and/or tables and just have it be between groups. Any comments on that from other board members? Not hearing any. Do we have a motion to strike out and/or tables by? Amend the language.
This is Cami. I'll change my suggestion to a motion and let it go from there.
Do we have a second?
Second.
All in favor?
Aye.
Anybody opposed? No. All right. Moving along, that will be passed with amended to strike out and/or tables. Other questions, concerns based off of that were brought up in terms of the ordinance?
Mr. Chair, this is Cami again.
Yes.
I would like to open the discussion on the duration and sort of when that Mr. Hunthausen proposed early on in the conversation about how to be clear about the duration of these rules so that it's very clear to the public that they're by no means permanent. And so I'm looking at both the triggers that are at the very first part of the document, which are the triggers for implementing them, and the triggers clearly state that if there are no triggers according to the criteria in the dashboard that we've been using, that there will be no regulations in place, and it defaults to full regulations. But it says in the middle that that we will use best science and best practices, which I think Mr. Lane explained well, that is our intent, is to find the middle ground for what is working and what we have been doing. So perhaps in the duration piece, both in the consistency with state regulations and emergency declarations, I think we've addressed a bit of tying that to the state and federal regulations, but perhaps not clearly enough. And then the duration section on page 15, it says that these will remain in effect until removed by the Board of Health, which I think, if I remember our previous discussion, means that we could, as a board, we could always remove them earlier if we chose, based on the metrics or what we were seeing in the community. But I think it's not as clear that that all of these things are tied together, that our best practices are tied to that. So I'm still struggling with exactly what wording I would suggest, but I think I'll start with opening discussion about how to tie those two paragraphs or 3 points together, perhaps in the duration section, to make it clear that that really is the trigger. Those triggers above in the previous part of the document are really tied to the duration and ability or consideration for these regulations.
Great, thanks, Cami, for bringing that up. Any other thoughts, comments on this topic, on the duration piece and wording from the board?
Mr. Chair.
Go ahead, Mr. Hanhausen.
I think, if we can just stay simple there and just add some of this, they'll stay in effect until removed by the Board of Health or the state of emergency, local state of emergency has ended, or I guess the criteria, the triggering criteria, suggests that they're no longer needed. But that might be under the removed by the Board of Health, because we'd remove them if there's no cases in the community. It goes below that threshold of having regulations in place. So, or maybe Drenda or Charles can recommend some language as well.
Do you want me to jump in?
I do.
Yeah, please.
I was just going to say, Mr. Lane, could you provide some language that might be a benefit and make it clear for public?
Sure. There seems to be some discomfort with allowing kind of an open-ended duration here. So, and I fully understand and appreciate that. So perhaps these rules and regulations shall be in effect upon adoption by the Lewis and Clark City County Board of Health and remain in effect for the duration of the national or state declaration of emergency or until removed by the Board of Health. Would that satisfy some of these public comment concerns?
It's okay by me. I just think we need to make it clear that these aren't permanent. They're not meant to be permanent. We're trying to address a public health crisis right now, trying to keep people safe in our community, trying to limit the spread of the disease. So just making that clear to anyone who might read these. And I think that's one of the things that we heard in public comment that was absolutely false, but it's something we need to address.
Yeah. I think what Mr. Lane had presented and communicated to us, I think that makes sense with the national, state, or removed by the Board of Health. I think that provides clarity on the duration of this, and would amend this to say exactly what Mr. Lane had put in there. Any thoughts, comments on that?
Do you want me to state it one more time just so we're all clear?
Yeah, would you, Mr. Lane, state it again for the board and staff?
Absolutely. So what I have here from I'm getting the direction from the Board of Health here is that shall remain in effect for the duration of the local, state, or national declaration of emergency, whichever is longer, or until removed by the Board of Health.
So moved, Mr. Chair.
Second.
All in favor?
Aye.
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 Any opposed?
I have some further discussion. I'm sorry that I wasn't able to say that before we voted. Can we talk about the pros and cons of looking outside of Montana as the duration versus a Montana state of emergency? I'd just like to think through that a little bit longer before we add national language.
Yeah, go ahead. And can you state that again, Ms. Claren?
Sure. I heard Mr. Lane say national, state, or local emergency, whatever is longer, and I thought maybe we could have discussion on the value of considering other states or just Montana before we vote, please. I'd be curious in Drenda's response, please.
Mr. Chair, members of the board, the language allows for the consideration of the national emergency declaration at each level, which is really important. Montana isn't walking through this pandemic in a bubble. We are interconnected here at the local level, state level, and at the national level. So each of those are really important. I don't know what to anticipate as far as which will be lifted first, but I do know that if we lifted our local the local declaration, emergency declaration first, we would lose access to federal resources. So I think that there's a lot of interplay with those declarations, and again, kind of interdependent.
Mr. Chair.
Oh, I was just going to say, Mr. Chair, Brenda, thank you. That helps me understand the connection.
Yeah.
Go ahead, Mr. Hunthausen, you have a comment?
Yeah, I was just going to add a little to that in that the states of emergency are very much linked. So the federal emergency is what is allowing for all of those federal resources to come downhill, whether it's PPE or now the vaccine is coming, and there's going to be widespread distribution. In order for states and local governments and local entities to be eligible for some of these federal assets, you have to declare a state of emergency as well. So our state does that, and then locally you have to do that. And so they fall kind of the same way too. When the crisis is over, the state of emergencies are almost lifted simultaneously. It is possible that one state could have a huge outbreak and the rest of the country doesn't. They might have a state of emergency, but then the federal government would probably declare a state of emergency in that one state, and they would still have those resources coming downhill. So typically the states of emergency are linked to each other, and they go away at the same way they came in, kind of as the emergency subsides. So the way Mr. Lane phrased it is probably adequate. It would be just fine to have that included that way in the language. And I'll leave it at that. Thank you.
Just a quick follow-on to Mr. Hunthausen's. I also was listening for the "or" in Mr. Lane's proposal to make sure, because just as you described, because of the linkage between all of the declarations. So to me, that was important, but I'm glad that you brought it up, Bree.
Thank you for that explanation.
Yeah, thank you. So right now I want to ask do we have any other discussion on amending the duration language to follow suit with Mr. Lane's language? Do we have anybody opposed to this amendment of the language around the duration? Not hear anything? We'll move that as and amend it with Mr. Lane's language. Thank you.
Mr. Chair, I think there was at least one other item, and that was related to persons having medical conditions precluding safe wearing of face masks. So the medical exemption and just dealing with that. And I was going to ask Brenda a question. So if that is removed, essentially what you're saying is that finding other options for people that may not be able to wear a traditional face mask, like a face shield, or they might not be able to eat at a restaurant, might have to do takeout, or I just describe what those alternatives are. I don't know all of them out in the world of public health. So.
Mr. Chair, members of the board, it's really important that our community and businesses that are held to the mask requirement, that they really search for accommodations, whether it's for a staff person or for a customer that may not be able to wear the mask. The definition of mask face covering does include several types: cotton mask, a surgical mask, a face shield. Those are all options under the definition of face covering. But I think the important piece here is the real desire and the need for our community to really think about what their business is that they're offering and how they can accommodate individuals that may not be able to wear that mask in a way that is protective of that individual as well as the public. There are I guess want to remind the board how important it is right now. We have very few tools in our toolbox to limit the spread, and the mask is one of the things that we know really does help to limit the spread. It protects the person wearing it as well as the broader public, and so compliance to that is really vital. And we need to have the majority of our public wearing a face covering in order for it to have the greatest amount of impact. And so fully recognize that there are situations in which individuals cannot wear a face covering. And in those cases, we need to make accommodations. We need to make sure that there's curbside delivery. We need to make sure that there are other ways to serve individuals in those situations. They need to be protected as well. If they cannot be wearing a face covering, we as a community have the responsibility to protect them as well.
Thoughts, discussion from board members on this topic?
Just one more question about that. Thanks for the explanation, Drenda. So I could see a need in the community for some education and some assistance to businesses. They might say, well, what are our options here? What can we do that meets that makes sure that we're meeting the rule or keeping people safe? And how do we do that? So just something to think about if we go forward here and how we go forward, that there may be some resources that people are going to need out in the community.
Is there suggestions on amending the language around the mask requirement or leaving it as is?
Mr. Chair, this is Cammie. I think the only thing I would potentially suggest is, because we want it to be clear that it's face covering, not that cloth masks, while they're potentially the most effective, that we haven't expanded and made sure to include face shields as part of face coverings in both the definition and by intent. Perhaps the title of Section 2 is mask and face covering requirements, rather than just making it sound like masks are the only option for folks who do struggle for the personal or medical reasons.
So on mask requirement, number 2, face covering requirements for certain organized outdoor events or in face coverings, instead of say mask requirement and include face covering.
Actually, I was just referring to the Section 2 on page 9, I believe, that the general, I think everything else refers to both face coverings and masks, and does a good job of making sure that they're inclusive. Perhaps that title of that entire section should reflect that same language so that it's clear.
Yeah. I would agree with that. At the top, Section 2, it says mask requirement. I would agree with that. It should say mask and or face covering requirement.
Yeah, that's all. It's something simple, and I think it was the intent and our discussions have centered around that. But I think to someone new to the document, and it just looks like it's masks or only masks. So while I agree with all of the other accommodations, I think there's accommodations on both sides, from both what the requirement is and helping businesses think strategically about serving customers while keeping them safe.
So let it be noted, on section 2, mask and face covering requirement will be amended in there. Do we have a motion?
So moved.
Do we have a second?
Second.
All in favor?
Aye.
Aye.
Any opposed? Not hear anything? We will move to have that amended and put into policy. Thank you. Board members, do we have any other discussion pertaining to this ordinance or any other discussion outside of this as well that somebody wants to bring up?
Mr. Chair, can we please address the youth activities comments?
Go ahead, Ms. McLaren, can you say that again? Sorry, you were cutting in and out.
Sure. I asked if we could address the 25-person cap during youth activities that came through in the comments. Could I be reminded of that discussion at the last meeting and where we landed so we could consider if that's where we still are?
Mr. Chair, members of the board, may I?
Yes, Ms. Needham, please comment.
Please.
The board discussion was around the importance of having those youth activities and the organizers of youth activities an approved plan that is adequate and protects those youth that are participating. And so it was recommended that it be stated that they're not exempt from the event restrictions. However, I do think that there's some clarity needed because it's the plan that's required, not the restriction to 25, nor the distancing, the 6-foot distancing. So if you think about a football team, for example, they're on the field more than between coaches and officials and players more than the 25. And then in order to play, they need to be within close proximity to one another. And so however, having a plan reviewed and approved by public health will ensure that all parts of that youth activity really have good precautions in place. So when they come off the field, for example, and are on the sideline, that they are distanced and they are wearing a face covering, that time during practice is being done safely, use of the locker rooms is being done safely. And so the plan itself is the most important piece from our perspective. And we just need to make sure that the kids are allowed to play, which means that they're not held to that 6 foot when they're engaged in their activity, or the total number of 25 either.
A quick question for Ms. Neiman. I agree. Thank you for that summary. That's the way I remember it as well, is that we were very clear in that we wanted youth activities to continue as they currently are. Does the plan does that same plan apply to the spectator side of managing the spectator side as well? Is that a singular plan, or are those two separate plans?
Mr. Chair, members of the board, spectators are addressed separately.
That's what I thought. Okay.
The rule, they're a separate and distinct event from the youth activity itself.
Thank you for the reminder. That's what I thought.
Any other discussion? Go ahead, Ms.
Your follow-up question?
Yeah.
Just to clarify, does this change any of the procedure that is currently happening? Does this make any new restrictions, or is this kind of keeping up what we've been doing?
Mr. Chair, members of the board, it actually formalizes what we've been doing. The requirement for youth activities to have a plan has not been in place. However, youth activity organizers, both community and school, have been really great stewards of these youth activities and have submitted plans. So in operation, it's happening. It just hasn't been stated clearly in the regulations. So this now states it clearly that it's expected that there be a plan in place and that they work with the health department to make sure that they have adequate protective protocols in place.
I have more follow-up questions. Mr.
Go
Chair,
ahead. Yes.
what say, I don't know one off the bat, but, say there's a organized youth activity happening without a plan in place right now, with the health department capacity being what it is. How might we maintain, quality of life for these individuals if we vote yes on this piece, while giving enough time to get a plan in place? And do you have ideas on how that might work or affect people?
Mr. Chair, members of the board, the youth activities that we are aware of, most have a plan in place. So I don't anticipate that there be a big disruption in youth being, our local youth being able to participate in their activities. The board can consider a grace period and allow those plans to be submitted and reviewed if they haven't already been done. Been done up to this point.
That feels like a good thing to consider. I'd be curious what other board members think.
As a board, I'm in agreement with that. As long as they've submitted the plan, worked with the public health department and the communicable disease team, and have a plan in place to eliminate the spread or decrease the spread, and provide opportunities for youth as well as others, as well as following the plan. Any other comments, thoughts?
Mr. Chair, members of the board, I would agree. I think that the health officer in the organization of Lewis and Clark Community Health is a great resource, and anything that people can do to educate themselves and follow the science is a good thing.
Any other question? Go ahead.
Mr. Chair, as Cammie's kind of been doing, adding some language, what would be a reasonable grace period for those few potential activities that haven't submitted a plan yet? And then we could perhaps suggest a piece of language.
So if I hear you correctly, what you're suggesting is adding a language around youth activities or other activities must submit a plan. And then you're looking for, which we have in there, but you're looking for a reasonable time frame or from a plan being submitted and vetted and approved. Is that what I'm hearing?
That's what I'm hearing. I'm just thinking if there is an activity, since this hasn't necessarily, to keep kind of quality of life as is that was the whole point of this, as I understand it. So with that philosophy in place, since this hasn't been a well-defined piece of our regulations, perhaps if we say, I don't know what my question is what's the turnaround for reviewing and approving community plans, and what's the average, how long does it usually take an organization or an activity to develop a plan and submit it, and see if we can't, add in a little cushion so we can keep everybody safe while also helping people adjust to this regulation should we pass it.
Mr. Chair. Well, Bree, I think we did discuss it the last time when we talked about because the county health department was overwhelmed with the volume of requests they received, and so they were talking about a week and a half, 2 weeks for turnaround period. But in here we see that if they can turn their plans in 30 days prior to the events or gathering, that's what we have here in the document.
Thank you, Mayor. I think my point is that if there isn't a plan in place and we have if we have a regulation passed, there might be an activity without a plan in place, and what happens to that activity?
Brenda?
Mr. Chair, members of the board, I do recommend that the activity proceed and they get a plan in and allow us to review it within that 30 days. So not disrupting the activity, but within the 30 days, get a plan in for review and work with the health department on making sure protocols are adequate.
Any other discussion or dialogue pertaining to the activity plan? Do we have any other comments from board members or staff around the COVID-19 response emergency rules and regulations? Not hearing any. First, I would like to acknowledge the public comments in the chat box and recommend them be part of the comment and the section of this meeting and are recorded. Do we have a motion in terms of the COVID-19 response emergency rules and regulations?
Mr. Chair, if I may jump in real quick.
Yes, go ahead, Mr. Lane.
Procedural matter, I recommend including in those adopting the public comments that we've received in the question and answer section of the meeting today, as well as the public comments received by the Board of Health.
Thank you for that. Do we have a motion to adopt those?
So moved.
Second.
Do we have a second? All in favor?
Aye.
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 Any opposed? No opposed. All right, thank you.
Mr. Chair, I think Brenda brought up earlier in her comments a little bit about that the county and the city both had letters that we submitted today. And I don't know if the mayor wants to read his. Ours is about 4 lines, so I'm happy to read ours. But I acquiesce to the mayor if you want to go first, Mr. Mayor. Or if, Mr. Chair, if this is the time to even do that. So.
Yeah, sure. Mr. Chair, may I?
Go ahead, Mr. Mayor. We can do that now. And then we'll have a vote.
This letter is from 3 commissioners and myself. Dear Lewis and Clark County Board of Health, we write today in earnest support of the proposed emergency rules and regulations under consideration at the upcoming December 17, 2020 meeting of the City County Board of Health. This week, our nation reached a horrific milestone in the COVID-19 pandemic, surpassing 300,000 souls lost. We continue to feel the magnitude of this loss locally in Lewis and Clark County and across the state. Despite the arrival of vaccines for healthcare workers this week, St. Peter's Health faces yet another month of strained resources and capacity. Our Lewis and Clark County decision-making dashboard clearly illustrate that our community remains at an unacceptable level of risk. The proposed adoption of the emergency rules and regulations are data-driven, transparent, and consistent with the practices currently followed by the vast majority of our community who understand their individual responsibilities in protecting our families and neighbors. The decision-making criteria will be familiar to those who have participated in the weekly Lewis and Clark Public Health webinars or visited the county COVID-19 webpage. The NIH and CDC report it will be months until vaccines are widely available for the general public. The CDC emphasizes that even after receiving the vaccine, it will be important for everyone to continue using all tools available to us to help stop this pandemic. like covering your mouth and nose with a mask, washing hands often, and staying at least 6 feet away from others. Thus, in these interim months, taking actions to protect our community and mitigate the spread of COVID-19 must be met with the urgency required to prevent prolonging the pandemic and the multiply crisis that accompany it. There is no economic recovery without public health. We can save lives and livelihood through the collective efforts of following the protocols required by the professionals, public health officials. We are grateful for the tireless work of our local health care professionals and public health officials during this global public health crisis, and urge support for the proposed emergency rules and regulation under consideration. Take care of our neighbors is a Montana value. Let's live up to the duty of that heritage. Sincerely, Wilma Collins, Mayor, City of Helena; Emily Dean, Commissioner, City of Helena; Andreas Halliday, Commissioner, City of Helena; Heather O'Loughlin, Commissioner, City of Helena. Thank you, Mr. Chair.
Thank you, Mayor Collins. And Mr. Hunhausen?
Thank you, Mr. Chair. Nice letter, Mr. Mayor. Ours is very simple, but supportive. We passed it this morning, and we had some good discussion, and I'll talk about a little. I'll try and capture some of that discussion in a moment here. But the letter reads, Dear Board of Health, and addressed to Lewis Clark City County Board of Health. The Lewis Clark County Board of County Commissioners supports the Board of Health in adopting the proposed final rules and regulations, which are up for your consideration at your meeting on December 17th, 2020. These actions in response to the COVID-19 pandemic are important and appropriate for our community. Please consider this letter of support. Signed, County Commissioners. So we just did a very simple, straightforward letter in support, but there was a little more discussion around that this morning. Drenda was there, as well as Mr. Lane was on our meeting this morning. But I'll try and capture it the best I can. Commissioner Giese was very supportive, very interested in talking about the vaccine, how the vaccine is going to come online, how these rules and regulations remain important until we have a large number of the population vaccinated, and that the transmission is still very possible, even though some of us may be vaccinated, and we need to do that. I think that the time frame that Drenda was talking about, that this whole first half of this coming year is going to be a challenging months for us until we have a large number of people vaccinated, and so very concerning. Commissioner McCormick was the same, and he really turned to the CDC's information and public health, and looked at it from a perspective of, it's not just about me or any one of us. And so a lot of the public comment I heard is, hey, you're taking my rights away and you're infringing on me. And he really came from the perspective of, we really have to look out for one another, and we have to pay attention to one another. And he used the statistics right here from the CDC, which talk about the 18 to 29-year-old group as the kind of the comparison group. And as you go up in years, he used himself, he went from 65 to 74 age group. You're 5 times more likely to be hospitalized, and you're 90 times more likely to die of COVID-19 if you get it, compared to a 20 to 29-year-old. And it goes up from there. 40 to 49 years old, 3 times more likely to be hospitalized, and 10 times more likely to die from the virus. So it isn't just about you and your age group, and people wonder why they can't gather, or why bars have to close early, or these kinds of things. But when they go and they may get the disease, and it may be simple for them, if you're a young person, it can be spread to family and friends and neighbors very easily, and can be very devastating. We've had multiple deaths in our own community. I know right here on my floor at work, one of my coworkers' father passed away from COVID just in the last weeks here. And so it hits home. I don't think any one of us doesn't know someone who's had the virus, and probably everybody knows someone who got pretty sick. Many people didn't get very sick, but the likelihood as the numbers go up are greater. And so it isn't just about us as individuals, and wearing a mask is pretty simple. I had really talk about it kind of like getting on an airplane. I don't mind going through security and taking off my shoes and off my belt if that means it's pretty unlikely that my plane's going to be blown up from a terrorist. And it's the same kind of thing. I don't mind wearing a mask if that means that my relative or my neighbor or somebody probably is less likely to get sick from this thing. It's not that big a deal. We know that there's a light at the end of the tunnel. We recognize that we're trying to follow the best public health practices. These come from the federal public health, they come from the state public health, and we're trying to implement them at the local level. We have a mandate to do that through law in terms of responding to this pandemic and trying to protect our community. And it is difficult for some. It is really hard on some of our businesses. It's heart-wrenching and heartbreaking for many. I think we recognize that, but it is important. And I was listening to the radio yesterday, and I heard Jerome Powell, who's the chair of the Federal Reserve, say the best way back to an economy that is robust is for everyone to wear their masks and don't get together. Stay 6 feet apart. Do not gather in groups. Wear your mask, and it will return our economy faster than just about anything. The vaccine is coming. We're not all going to be vaccinated probably till spring or summer. But if we can wear a mask and not gather, we have the best chance of turning things around more quickly. And if more people did that, if more people respected each other and respected these simple wash your hands, wear a mask, stay 6 feet apart, everybody did that, we would have been done a long time ago probably. We would have been moving on from this in a more robust way. So I implore people to take care of themselves, take care of others, and when you wear a mask, don't think about you and your infringements. Think about how you might be protecting someone else that you come in contact with or that you may have to work with or that you love in your family. So I'll get off my high horse here, but it is really important. I speak from facts. One more thing. I just saw this today, an interview with Dr. Fauci, who's one of the leaders nationally, and said the 5 things need to do. Nothing's really changed. Wear a mask, follow social distancing guidelines, avoid crowded situations, and if possible, do activities outdoors and wash your hands frequently. I mean, it's pretty simple, pretty straightforward, and the rules and regs that we're proposing to put in place, from my perspective, are just putting those 5 simple things into practice in a formal way in our community and giving us guides about how those will work in our community, work with businesses, work with employers, and work with one another and our neighbors. So please, this group of people is trying to do their best to follow the law and protect our community, and I hope people will generally support this board and the work that they're doing. These people are fine people, all volunteers, spend a lot of time learning and working on this stuff, and I just appreciate your work as well. And the County Commission is in full support of you moving forward. Thank you, Mr. Chair.
Leave a comment and tell us your thoughts. More videos coming soon.